Hello lovelies, and welcome to today's video. My name is Alya and I'm so glad you stopped by. So today we're talking about 15 diseases seen on eye exams that you might not be expecting. So we'll be talking about everything from diabetes to tumours or multiple sclerosis. How do we see it in the eye? Well, stick around and I'll tell you. Just this week I had a patient doing a regular routine eye exam. I just thought it would be a really great idea to do a very quick scan of the back of the eye, purely routinely, just because I noticed that we hadn't seen her in a while, and also, just things have started to deteriorate. I thought it was quite normal deterioration, things that could be caused just by normal time delay. 3 years or so had gone by, you'd expect some changes to the vision. Things still were very correctable with glasses, everything was great, but then I just had this inkling that it would be a good idea to check the back of the eye, and she was all for it. And then as I was just having a little look around, she started to mention that, she'd been under a lot of stress and she didn't feel that her vision was as good, even though the eye exam had gone really well so far. She just felt like, actually her eyes weren't doing as well as she would prefer. And I sort of said, well, your eye exam was really good. This is just a precaution. And she'd agreed and was happy that I was going to investigate. One thing that definitely did come out was I thought her eye vessels looked a little bit funny. When I say funny, I didn't think anything specifically was wrong with them. I just didn't instinctually like how they appeared. And I sort of said to her, have you had any episodes of high blood pressure or any issues with your blood pressure? And she said, well, actually, now that you mention it, yes, I have. And she had not told me all this time that she had been taking a new medication, even though I always ask if there's been any changes to medication, and I checked that the medication we have written down is still current, and she hadn't been on anything in the past. So, this information was just simply lapsed because she just didn't think of it. She's just so used to taking it every day, I guess, that it just didn't occur to her that it was important to mention. And she goes, I completely forgot, but I do have this thing that I take with all my vitamins every day. And I'd recorded all her vitamins, just not her actual medication. Turns out she did have some really, really high blood pressure, and the GP had already found it the year before. As I mentioned, we hadn't seen her in a while. And it was all under control now, but it had gone up really, really high at one stage. And she was so shocked that her eye exam was revealing that there was something wrong. She was really, really worried. So look, don't worry at all. It's going to be there. It's going to be a sign that your eyes were under some sort of vascular stress at some stage. But now you're under control, and that's the most important thing. Because if you weren't under control, my next step would be to send you to someone who can get you under control. So this leads me to the list of other diseases that can show up on the eye. So we've already spoken about blood pressure or hypertension, and even past cardiac events can definitely be something that you can find on the eye as well. So if someone's had a stent or had some sort of heart attack or some sort of stress when it came to the cardiovascular system, you will definitely see something on the eye. This could be a past event, it could be all under control, but it will be there, which is important to note that some things are not news, but a lot of the time the patient is unaware that they've had an event. Sometimes they haven't had a stent, or they haven't been diagnosed by their GP, or they didn't have any other health exams to reveal it. Oftentimes we get complaints of headaches, because people do get vision symptoms with their headaches, and we do end up diagnosing from there. So sometimes we get to find aneurysms. Often aneurysms are silent and there's no signs or symptoms at all, but some lucky people do get headaches. And those headaches can often be the only indicator that there's a bit of a ticking time bomb sitting in your head. Oftentimes, because the eye system goes so far and wide throughout the head, it starts at the front where the actual eyeball is, and it goes all the way back to the top of the neck, and it sort of sprawls out everywhere in between. Because it's covering so much real estate, often the eyes get involved when there's something changing in the brain. Another example of that would be tumour. And while we're on the topic of tumours, the other thing that can definitely be diagnosed on the eyes are skin cancers. Basal cell carcinomas, squamous cell carcinomas, and melanomas are all common to the eye area. The eyes are very exposed to the sun. We very rarely cover it with clothing or anything. So unless you're a very determined sunglass wearer, chances are that the skin around the eyes can sometimes be a little bit changed or damaged. So that therefore, we do take out quite a few basal cell carcinomas, probably the most common. Occasionally, unfortunately, a squamous cell carcinoma. Very rarely a melanoma. They tend to pop up more at the back of the eye, on the retina, than on the skin of the eye, but it definitely can happen. Melanomas are most certainly common, especially here in Australia. I haven't really seen too many in my practice. I think that most people these days do have some sort of slip, slop, slap awareness, do wear sunscreen and do wear sunglasses. I can't speak for clinics that deal a lot with that sort of stuff. But we certainly have seen a lot of patients that have had melanomas removed from their nose, from their ears, from their backs, more so those type of areas that have prolonged sun exposure. As I mentioned before, the eye covers a really large area of real estate throughout the brain. And in order to measure that pathway or any effects to that pathway, instead of having a patient do an expensive and time-consuming and difficult to come by test like an MRI or a CT, we can first do a test that's very available, very easy to do, quick and relatively inexpensive. Here in Australia, it's very heavily subsidized by Medicare, and that is a field test, a visual field test. My machine of choice is a Humphreys, because the software seems to be more accurate and definitely more malleable for the patient's needs. So it goes slower. If the patient is slow with their response, it speeds up. If the patient is responding quickly, it has a threshold type intelligence, so it understands what you can and can't see, so it doesn't bother showing you anything extra. But there's a very comparable machine out there called the Medmont, which I know a lot of optometrists like to use, and that's fine too. Not ideal for certain types of testing, but more or less does the job really well as well. So either of them is really good. The importance of this test is that it will actually highlight any kind of compressions or any kind of disruptions to that pathway that's all around the brain. So if you do have some kind of tumor or aneurysm or anything going on, then it should pick it up if it's pressing on the field, on the pathways that then make your field of vision possible. Because all those neurological pathways are there for is to give you your peripheral vision. So our peripheral vision is more or less roughly divided into quadrants. So you have sort of 12 to 3, 3 to 6, 6 to 9, and then 9 to 12 all the way to the center. Things tend to respect a midline or horizontal division as well. And by the placement of the deviation or the missing vision, we can often tell which particular part of the nerve pathway is then being compressed or affected. Now, aside from tumors and aneurysms, you can also have other types of changes to that pathway, often caused by things like diabetes. So you can have a little bleed or a little leak because the vessels are weak in the brain, and that can cause a temporarily sort of squash to the eye pathway as well. The other place diabetes shows up a lot is on the actual retina. So the retinal exam, or that picture that I mentioned before in my patient, it's a bunch of really, really tiny vessels that we blow up very largely, and we do a cross-section scan on using just photography. Very, very high-level photography, very, very high-tech, but that's all it really is at the end of the day. And these photos can reveal really interesting things. Not only do we look at things like the vessels, we also look at the very, very back of the eye where the nerve and the eye connect, and that can tell us a lot as well. One of the things that we can diagnose from looking at the nerve that has not that much to do with the eye is multiple sclerosis. So multiple sclerosis will cause the optic nerve to swell temporarily when there is an episode, and it can cause severe vision loss again temporarily just during the swelling episode. It tends to then be very recoverable with the right diagnosis and the right administration of steroids. It has to be done in a timely manner, in a very specific fashion, through IV in a very specific dose, but it definitely does help, and a lot of people recover really, really well from episodes of optic nerve changes due to multiple sclerosis. And even if it's not multiple sclerosis, the treatment tends to be very similar for any kind of nerve swelling, because you just want the immune system to stop attacking that nerve so that the vision can be restored. Other things you find out by looking at the back of the eye is sometimes you see these little plaques or these little sort of hyper reflections back at you from the photo, little yellow spots. And they can mean different things, but a lot of the time it can mean a lot of cholesterol. The other thing that can happen with a lot of cholesterol is you can have a ring around the iris that looks kind of blue or kind of grey or maybe even white, depending how severe it is. And that's also from having way too much cholesterol swimming around in your body, and it just finds a place to settle. So if it's not settling in your blood vessels, blocking them, it'll find its place somewhere around your organs, in your iris, around your cornea. It'll find a place. So definitely with cholesterol, diet is my opinion. I think it's what we put in or what we forget to put in these days with good ancient grains and fibers and things like that, that causes these things to happen. I definitely am not a fan of just medicating everyone. I definitely recommend lifestyle choices first, and then if that doesn't help after say 3 months, then there's always the choice of going on a medication down the track. So I love that we have that option and that knowledge these days, and oftentimes access. A lot of my patients are financially in the position to be able to make expensive lifestyle changes. And, you know, eventually over time, once a change is made, it actually works out to be cheaper to eat well than to eat fast food or processed food. But initially there's a big commitment to changing the pantry and the palate. So I'm really, I consider myself really lucky that I can guide my patients through these decisions and that they can afford to make them. But it's definitely not for everyone, so no judgment for those who opt for medication first and everything else later. That's definitely a choice as well. When we look at the eyes, we also look at the eye movements, whether the eyes are able to move around fully and equally with the other eye. So any kind of random and very unusual double vision, something that's usually sudden onset, so it happened really suddenly, not without much warning. It could be a sign of a stroke, and that's something we sometimes also see at the back of the eye or on the field test, along with the other vascular findings. Or sometimes we see this anomaly in the eye movements. Aside from the optic nerve, the nerves that control eye movements also travel the entire course of the brain. They have a very long pathway. And sometimes we see that pathway be disrupted, and that shows up as double vision or sometimes just anomaly in the eye movements. So normally if I move my eyes left, both eyes will move together to the left, right, up, down. If that's somehow disrupted, that's usually a sign that either my muscles are inflamed or somehow blocked. So in this case, I'm thinking thyroid eye disease, or there's a nerve issue, and then I'm going back to all the vascular stuff that I would want to check on. Sometimes we get this really strange inflammation, very painful, very light sensitive, inflamed eye. And it would happen more than once. It would happen with a recurrence. In this instance, we're thinking rheumatoid. Sometimes you get this what's called uveitis, or swelling of the body that controls the iris from expanding and contracting, so the size of your pupil. And it has a few other functions in there, the ciliary body and the uvea, so a little body that sits behind the iris. If that becomes inflamed, we're definitely thinking, wow, is there an inflammatory disease going on? It's not normal for that to become inflamed in of itself. It's not exposed like the conjunctiva where you just get pink eye. If it's involving the inside of the eye, then we need to look at internal factors there as well. Definitely do not ignore the front of the eye and dry eye. If you guys have seen my videos before, you'll know I talk about dry eye a lot. I suffer from dry eye myself. And while we're on the topic of autoimmune diseases, there is such a thing as Sjogren's. I can't say it. Disease. That's where your white blood cells attack the glands around your body, causing dryness in your saliva gland, in your tear gland, all over. And these people unfortunately suffer severely with dry eye. I mean, these are people who cannot go an hour without putting some eye drops in because it's that severe. These will also be people who will have to use a special mouthwash to keep their mouth moist and their gums healthy. This disease is really, affects so many different parts of the body because of that gland attack. And so there's definitely sort of that lack of moisture is not even the right word, lack of lubrication around the body. And we definitely take for granted how important our glands are and the things that they produce are. They keep things healthy. They keep things in check and in their status quo. Without correct lubrication, without correct sort of movement and nourishment and production, things can't work as they should. So for people who have an actual chronic disease or inflammatory factor, rheumatoid factor, that has that sort of effect, I really feel for these patients because You know, it's not something they're doing with their diet or with their lifestyle that's creating this problem, like with me, who doesn't go to bed on time or spends too much time on technology, or maybe doesn't hydrate enough. This is something that their body is doing. So I really do feel for these patients, and I definitely am constantly experimenting with different eye drops on myself as a bit of a guinea pig to see which ones are the most effective for longer, because these patients will gain so much more benefit than the rest of us who just have eye fatigue that's causing the dry eye. Such a long list today, guys. I didn't mention vitamin A deficiencies because they're so unusual in Australia or where I work, but that's definitely something else that comes up on a Google search of things that can be diagnosed. The list does go on beyond 15 different diseases, but I thought I'd cover the ones that I have definitely seen numerous times in clinic, because to me they seem more common or more relevant to the type of demographic that I deal with personally. So I'm actually able to comment, and I know what it looks like when you find it and what it feels like when you find it as a clinician, and often how to approach it. It's very difficult to tell someone that I think you need blood tests because I think you have diabetes without actually having the blood tests and numbers in front of you. This is all on suspicion based on what you're seeing their vessels do. Sometimes it's obvious, you know, and you know that the blood test will confirm everything that you think, but all it is really a photograph, a very, very high-tech, very comprehensive photograph, or a very time-consuming, accurate exam. But at the end of the day, you're on a hunch when you're sending that patient back to their GP, or sometimes even my ophthalmologist that I work for will send off for the actual tests just to speed up the process. But at the end of the day, we're there for their eyes and for the maintenance of their eyes, which we are very good at, but you do have to work with other professionals, whether it be physios sometimes, or GPs a lot of the time, or other specialists like rheumatologists or endocrinologists to help people deal with their diagnoses. So often we're the ones that find it, but we're definitely not always the ones that then go on to treat it and to help people manage it. All right, guys, today was a really long and definitely detailed list of things that an orthoptist or an optometrist or an ophthalmologist might find on your eye exam. I definitely recommend that if there's nothing wrong, at least every 2 to 3 years to take yourself to some form of eye exam. It's really important that somebody has a look at the back there, no matter how healthy and unproblematic you think you are. It's just good to have even that all clear given to you. A lot of the time these tests can be much more revealing than what we may suspect. If you like videos like these, please do drop me a like, leave me a comment to tell me what you have experienced in your latest eye exam, and did you find it surprising and revealing what your eye professional told you about your health? For more things about eyeless creations and all the many different hats that I wear, please head over to Instagram and see more regular updates about family and the soup kitchen and all the other things that I do. Definitely hit that big red button, turn it grey, and become a part of the Eyeless Creations family. I don't post a lot, so you won't be bothered by the notifications. To get a little bit of a notification, if you did want it, hit the bell as well. Hope you're doing very well out there and you're staying safe and happy and things are going well wherever you are. And thank you so much for watching this video. I can't wait to see you on the next one. Bye.